Hi, I'm Rebecca Farletti, a public health nutritionist at Health and Wellbeing Queensland. Today I will be presenting on an exciting new program we're developing in partnership with researchers at the University of Queensland. I'll be focusing on the development process and how we've worked together with children, parents and carers, health professionals and a creative agency to develop a health and wellbeing program that is practical, evidence-informed and most of all, fun. Before I begin, I would like to respectfully acknowledge the traditional owners and custodians of the lands from across Queensland. We pay our respects to the elders past and present, for they are the holders of the memories, traditions, the culture and aspirations of Aboriginal and Torres Strait Islander peoples across Queensland. This is Sarah. She's a mum, and life is busy. There's work, school runs, birthday parties, appointments. She's doing all she can to give her kids the best possible start to life. In the busyness of it all, sometimes certain things can take a back seat, like going for family walks or having home-cooked meals together. Cost of living pressures and living away from bigger towns means that fresh food can feel out of reach. Sarah asks her friends and looks for tips online, but the ideas aren't a great fit for her family. Or what she may not realise is that the advice she's receiving isn't that great in the first place. Despite their best efforts, many families face barriers to healthier living, some within their control and some beyond. It's really important we look at all different ways to better support families. We know that healthy eating and physical activity behaviours are often established in childhood and are important for healthy growth. However, very few kids are eating enough veggies and moving enough each day, and 1 in 4 Queensland children live with overweight or obesity. Family-based prevention programs are an effective way to support children and families with healthy behaviours, and doing so can make a significant difference to children's well-being across the life course. The evidence shows that online platforms can offer a cost-effective and scalable delivery method that overcomes common barriers to accessing face-to-face services, including service availability and transport. Right now, there are no free, universally available services in Queensland that target child obesity prevention. This is a big gap. Where do health professionals refer patients to? And where can families look for practical and evidence-based information to support them with their health goals? At Health and Wellbeing Queensland, we're creating Pod Squad, a free, play-centric online wellbeing program that supports children and families as they build better lifestyle habits together. It explores nutrition, physical activity and wellbeing with a focus on family-based health-promoting behaviour change. Initially, we're targeting Queensland families with primary school-aged children. Our approach is underpinned by co-design and design thinking principles. Our UQ research partners conducted surveys and focus groups with parents, carers and health professionals, which informed our program strategy. Our creative agency, Chemistry, conducted a robust discovery phase with subject matter experts, parents and carers, and children. This defined the delivery method and program scope. Creative concepts were shaped by children and parents. They told us what they liked and what they didn't like and gave lots of suggestions that shaped the final concept. We're now in the production phase, where we're regularly testing our work in progress with our key audiences. We're engaging families every step of the way to make sure we're building what they want and need. So far, we've had over 200 families share their insights with us. About half of those have been engaged through surveys, while the other half participated in focus groups, one-on-one interviews, workshops, and advisory groups. We're working hard to ensure we have diverse voices shaping the program. By co-designing with families and health professionals, we've been able to hone our messaging approach. We've learned a lot to inform what we're saying. Providing realistic advice that supports families towards healthier behaviours will be better received and likely more effective than focusing on what is ideal but probably unachievable for many. Families and health professionals emphasise the importance of being encouraging in both language and design. For example, by shining a light on the family's strengths, celebrating trying new things, not just succeeding, and building in-app rewards to encourage repeated behaviours. Families want the experience to be flexible, so we're building the experience around the family's and child's health goals. This means that different families will progress through the program in different ways. We learned that for kids, messages are more compelling when they're delivered with a touch of quirkiness, humour, and with the right balance between cute and cool. And this is especially important considering the broad age range we're speaking to. How we're delivering our message is just as important. For kids, it has to be fun and playful. Our child messaging focus is on learning that doesn't feel like learning and emphasising immediate outcomes and benefits. For example, getting a good night's sleep will help them feel awake during the day and do all the things that they enjoy. Our child content is delivered in really interactive ways, including through mini games, animations, digital challenges, and real-world quests. We heard loud and clear from families and from health professionals that it mustn't feel like homework. Digital features like in-app rewards and challenges also help to drive motivation. Kids and parents alike emphasise the value of having a way to facilitate a bit of friendly competition between family members. Parents want to know the information they're receiving is trustworthy and fits their family. So for them, our focus is on providing practical, evidence-informed strategies to make small, sustainable changes that add up over time. As the child explores the world and tries new things, parents receive complementary content to support them along the way. Most importantly, while our delivery is through digital platforms, everything we do is focused on supporting real-world activities and changes. The child's experience is deliberately structured so that short bursts of learning drive sustained behaviours in everyday life. As a prevention agency, Health and Wellbeing Queensland is focused on driving change so all Queenslanders have the best chance to live a healthier life. We do this by working with amazing partners and collaborators who all bring different strengths. Our creative agency, Chemistry, brings their skills and experience in delivering health behaviour change through digital platforms. They also bring a much-needed element of fun, play and exploration, which brought our health information and research goals to life in a truly exciting and innovative way. Our research partners at the University of Queensland are focused on understanding what works, what needs improving, and how we can better reach more families over time. Our cross-sector partners on our steering committee, advisory group and expert panels help ensure we're setting this program up in a way that maximises its benefits and is sustainable and scalable. Above all else, this project has shown the immense value of working with families. Our creative concept wouldn't have been as strong without the imaginations of the children we spoke to, and it wouldn't have been as practical if we hadn't asked parents what would really make a difference to their families. Once the content and technical production concludes, we will conduct a pilot of the program with approximately 20 families. We'll follow their experience closely to understand what's working and what needs improvement. We'll then launch the program statewide. This is expected to occur mid this year. Post-launch, our aim is to continue expanding the program both in content and functionality and evaluating through research activities and consumer insights. This will ensure it achieves the biggest reach possible, but more importantly is reaching those that need it the most. In doing so, this program aims to reduce the barriers faced by families just like Sarah's, so more families can build better lifestyle habits together. Thank you for listening. Please contact me if you have any questions or sign up to our newsletters for regular updates.